All right, everybody, welcome to the InterSystems booth here at HIMSS. We're so glad to have you guys. We're also going to Facebook Live right over there, so wave to the Facebook Live people. Everybody say, hey, we miss you. We wish you were at HIMSS. All right, but next year we can always get them. But before we start with our presenter, I'd like to warm you guys up a little bit. Now, here at InterSystems, we know what you want in a solution. We know it even before you do. It's like we can read your mind, and I'm going to prove it to you right now. A little mind reading, a little mind reading. So right here, what is your name? That's correct. See how this is working? All right. Now, John, I want you to do me a favor. I want you to think. Just think of any number between 1 and 5. Think of any number between 1 and 5 and let me know when you have a number. Excellent. Now, do me a favor. In a loud voice, so everybody can hear today, what was the number you were thinking of? 3. Amazingly enough, my prediction, 3 right there. Okay, it's stupid. All right. But you guys will be doing it on Monday. All right, that's all right. A little warm up for you. But right now, I'd like to bring up James Hyman, Enterprise Information Architect at Northwell Health. Let's give him a great big hand for James.
Great, thank you.
Yep.
Great, so good morning. My name is James Hyman, sometimes known as the HIE man when spelled correctly. Industry professional with about 11 years in health information exchange. The first half of my career was mainly on the public HIE side with Lipix, now known as Healthix. And the second half is with a large IDN in the Northeast New York metropolitan area. So Northwell is the largest private employer and health system in New York. Currently has over $10 billion in revenue, serves 8 million patients every year across many different avenues of care, with 22 hospitals, 600 plus ambulatory practices, close to 60 urgent care centers, and a full gamut of post-acute services, all with a focus on research and innovation. In a given year, Northwell touches the lives of over 4 million people with over 1 million based hospital interactions, 4 million ambulatory interactions, with 150,000 ambulatory surgeries. Northwell provides 100,000 ambulatory transports, partly streaming from our 911 call center for part of the region. Another interesting stat, Northwell delivers 40,000 babies each year and a key leader in the region. Here's a map of Northwell's service area, primarily based in Long Island, New York City, and the Westchester area, but alliances internationally with Sweden, I believe another InterSystems customer of the entire country, as well as with Cleveland Clinic and our snowbird population in Boca Raton, Florida. Based on all these clinical interactions, all within a siloed ecosystem, the HealthShare data platform provides a vital glue to get all of these venues of care on a single platform, creating a single consolidated health record. Over the 4-year journey, the platform has amassed over 1 billion data points, covering 7.5 million lives, with hundreds of thousands of diagnoses, observations, and results. So what do we do with all of this data? I've taken the liberty to look at the solutions from 2 lenses: capabilities and experiences. Capabilities, or foundational services, we can expose the data through APIs, mainly with an internal XML format called SDA. In addition, InterSystems does a great job of exposing almost every one of their functions through an API. Notifications, analytics, and tracking programs within are highly leveraged as capabilities within both the InterSystems stack and within almost all of our solutions. In addition, we have built out several applications, or UIs, both within the HealthShare framework, like the clinical viewer, and custom applications leveraging industry standard UI frameworks, both simple and complex, all leveraging the HealthShare data model. Commonly, our apps focus on either gaps in existing clinical workflows, not normally covered by an EMR, and the customers who don't necessarily have an EMR yet, like a care navigator or our call center users. Let me walk you through 2 ways that we leverage HealthShare as an innovation backbone. The first is looking at risk management and population health tools. In the process, we generally receive a member roster from an insurance company. We load and manage that data into the core HealthShare platform as another edge. Baked into the ingestion process in matching that list out within the core clinical activity. On the innovation side, we extended the core matching framework in 2 different ways. One, we came across a scenario where inconsistencies with matching risk records to each other, so we built out an additional framework to support linking 2 risk contracts together, in addition to what was already happening, linking that risk contract to the rest of our medical data. In addition, we built out a framework to be able to look at identity management through different lenses for different reasons. For the clinical use cases, we need to provide the standard high risk adverse, low false positive or false positive unacceptable approach. But for areas like financial risk management and care coordination, we look through it through a completely different lens where we could massage it and cater it to a way that we wouldn't miss anybody. Stratification of cohorts, we leverage InterSystems Health Insights platform, an analytics-based population health-centric view of the data where we built out several models for risk stratification, both encounter and population health-centric views. We leverage the InterSystems clinical event notification framework to detect actionable, simple events in real time that are occurring so that a care navigator can engage with the patient, to then proceed with a series of interventions that can be applied. From there, a full-blown in-house application leverages APIs to get data to key data points across a single sign-on, and also has a single sign-on connection to the rest of the HealthShare cross-continuity of care record. Leveraging Cache and some embedded APIs, we built a connected assessment engine as well to help record key clinical transitional information around behavioral and social determinants to the patient's care. All of this content is then fed back into the HIE for use at the next episode of care. So with this model, HealthShare is very centric to the innovation capabilities, and especially when this was rolled out 2 years ago. Taking a slightly, and then here are some other capabilities and slides. I know that they're hard to see, but you've got an analytics dashboard in the top about how some of the interventions and access to our clinical viewer, our risk cohort notification metrics on the side, how to configure a smart program in the Health Insights platform, and also our standard matching capabilities. Taking a slightly different approach, here is another model that we've built out applications, leveraging the great work to create the easily accessible data through APIs and the core technology that the HealthShare stack offers. We have exposed key events coming into the HIE to an event queue where our rules engine can evaluate data from an episode of care, as well as looking at the entire record to determine if an intervention is required. When it's determined that it is, leveraging a simple UI using a rapid application development platform and simple business process for managing how we want to follow up with those patients, we built out a tool that we call the List app. The beauty is in the simplicity and the appearance, but leveraging the power and complexity of the data under the covers. So where does that? So this is the List app. So this is a simple UI with a list of patients. When you click on one of those patients, it'll bring you into the interaction screen where you can record what's happening between the interaction between, in this case, it's our call center agent trying to make a follow-up appointment with a patient, and they can record certain pieces of information where our assessment engine is also connected. On the top left is the simple rules that were used to evaluate whether or not the patient would qualify for the list. This is the business process that caters to the workflow around the call center interactions. So if the patient answers the phone the first time, great, they'll move on. But if they don't, there's a whole cycle around how they intervene and when they come back onto the list to make additional appointments. And at the end, we've got metrics and a dashboard to be able to show the rest of the interactions. So where does this bring us? So we're in the process of creating an innovation backbone. So essentially, in our innovation journey, our organization, like many others, have attempted to create new income streams and has invested in an innovation center. In this backbone, we've created a data set that companies can come and leverage and partner with, both co-building and trying out their own products. The possibilities in this space are endless, especially with the data and the ability to simulate the data in motion in like a real-world clinical scenario. Finally, for fun, I have included some more information with a word cloud of where we see our innovation capabilities expanding in the near future. With HealthShare still at our core, the emergence of their FHIR gateway that will make data accessible even easier, and powered through some of the new tools that we're planning on bringing into the space with Azure API management and the emergence of additional powerful cloud tools to be ready for the next big thing and new ideas, and to build out those new experiences as they come to our innovation lab. Thank you very much, and I'm happy to take any questions.
James Hyman, everybody. Big hand for James. So do you have any questions here for James? Anybody? Questions, concerns, any comments you'd like to make? We'd love to know you. All right. Well, if you guys have some play around, James, how can they get a hold of you? Where can they find you?
Sure. I'll hang around for about a half hour.
Good.
Answering any questions. With the internet connections, I can pull up some stuff to continue to show and demonstrate some more of the activities, and maybe even make it. There's a question.
Oh,
go for it.
Down here. I'm bringing the mic.
Could you talk a bit about how the use of HealthShare has changed physicians' workflows and how they use it at the point of care?
Sure. So one of the main pieces of intervention, we're in a pretty disparate EMR base, right? So there's two different ways that at the point of care that they're leveraging the tool set. One of them is logging in connected into their EMR with a click of a button is a single sign-on connection out to the HIE clinical viewer, so they can see that cross continuity, that full record across the entire enterprise. In addition, we also have embedded notifications directly into their EMR task workflow, which would then drive some follow-up activities. In addition, we've also just begun to scratch the surface of embedding key risk metrics in front of the patient, in front of the provider, to potentially help in both doing things like they're facilitating gaps in care, and also likelihood for readmission scores and other ways that they could potentially intervene before the patient even leaves the office or the hospital or whatever setting it might have been.
Cool. Any other questions? Did I miss somebody? Okay, let's give one more big hand for James. Big hand.
Great.
And
thank you.
Don't forget, we have fire luncheon here at noon, so you want to check that out. And can I scan everybody real quick so it looks like I'm doing my job? I appreciate that. All right.
That was excellent. Thank you.